All right. Dr. Scott here with JP. JP, you fractured your foot playing basketball. Ankle.
Yep.
Ankle.
Small fracture. Playing basketball, landed wrong. A little chip in there. He's out 10 weeks total. Came back. Playing time without pain. Just recently tweaked it a little bit. Playing with a little bit of pain.
Okay. So fractures happen because of an excessive amount of force going into a joint. Sometimes when you tear something or you have one of these fractures, it's due to basically the soft tissue around that structure, particularly the ankle. The muscles that cross it have to be healthy. So the less healthy they are, the more adhesion they have, the less range of motion they have. So when you load it, you're trying to jump, you're trying to run, instead of stretching out, allowing that range of motion to happen and that spring-like activity to happen, it'll say, hey, JP, I can't go any further. So I have to borrow some range of motion from the joint space. So what do we end up doing? We end up compressing the bone, compressing the joint, and sometimes you get a little stress fracture. So what we're gonna do here is we're gonna look at JP's ankles and feet, and we're gonna see what kind of health he has. So our first test here is going to be ankle range of motion. Now, you're a tall guy, but generally the rule is you should be able to have your big toe 6+ inches from the wall, heel on the ground, knee to the wall. So I'm gonna just move this camera here real quick so I get a better view. I'm just gonna hang on down to the ground here. The rule is everything has to face the wall. Heels on the ground, these heels can come up, knee touches, everything's going straight forward. So you're not shifting your hips, the feet are staying straight forward, so you're not gonna collapse the arch and borrow some range of motion. No cheating. So you're gonna keep the knee on the ground, heel here, bring the knee to the wall for me. Oh, come on. Let's see it. Go as far as you can. Keep going.
That's about it.
I want to know exactly how far you can go until your heel's about to come up.
Okay.
So we're at 6 inches here, and you can see we got a couple inches here. So what I want you to do is I want you to go up to, say, about the 4-inch mark here on our ruler. There you go. This heel can come up, by the way. You just have to have some amount of load in there. So knee to the wall. Very good. Does that feel like the maximum amount of range of motion, or do you have a little more?
I think I got a little more.
Okay, let's slide back just a touch. Now, as an athlete who makes their living making money being an athlete, having every bit of function is key to being your best person here, right? The best player possible. So right here, he's at about 4.5, maybe a little more. Takes him to about 75% function. You're gonna keep your knee at the wall now.
Okay.
Now, is this the problem foot?
Yep.
All right, so what we're gonna do now is I'm gonna do some selective tension.
Okay.
Staying there, I'm gonna try and figure out what is limiting this range of motion. Where do you feel tension or pinching or anything? Right in here?
Right in there. Yep.
Okay, keep the knee at the wall for me. So looking here, on this inside, you have your big toe muscle wrapped through here. You got your little toe muscles wrapped under the foot through here. And ultimately, we need to see what is limiting. So I'm gonna lift up in this big toe. Keep the knee at the wall for me, please. See how this doesn't wanna go anywhere? And then I can try to pick up these other toes. That goes a little easier. This big toe, though, doesn't wanna go anywhere. So that's telling me this is the most likely reason you've lost a quarter of your ankle bone. So there's no pinching here?
Nope.
Any tension here?
Nope. No.
Awesome. Now we're going to see what the good side looks like. Because after all, if both sides suck, maybe this hypothesis is wrong altogether. So if the injured side is worse, that's telling us we got to look closer. If not, we got to look somewhere else. So you're going to start here at that 6 inches, heel on the ground. Go ahead. Got it. So now we for sure, I can have a little more range of motion, but he's at full range. He's at 6+ here. So the healthy one has nice range. The unhealthy one is missing a 1/4+ of the function. So now we're going to look at and see which tissues are the problem. All right, let's mix it up here, JP. You're not going to be my biggest fan here, but you're going to put, what is it, the left one?
Yep, the left.
You're going to go just like this.
Okay.
And can I have you pull up, I need to get to the skin here. So
Yeah, go ahead.
let's pull this up here, maybe do a little unzipping. We don't want to stretch this out, that'd be terrible. Okay, keep the leg there. Just stay nice and relaxed. So just let this rest here. Okay. So now, thing is, JP has symptoms near the ankle, but since we have a soft tissue restriction, that means you can have symptoms anywhere in the system. So for instance, his big toe muscle wraps under here, goes all the way up here. The flexor for the rest of his little piggies here stays here, goes up into here. Then you have a muscle that just flexes the ankle right in here. And you have two ligaments that if they don't stretch out, they'll cause some pinching. He didn't have that. He had something that's probably due to one of these other three muscles. So we're going to look at that. Healthy tissue is going to be soft and supple. So anything firm and tender, you could see JP's eyes right now. There's going to be some points where his eyes are going to look like they're going to jump out of his head. Because this stuff is not the healthiest. So as we go in here, you'll notice this a little softer, right? And then we hit this wall where it's just not compressible. That's where the adhesion is in that big toe muscle. Now we can go up kind of Main Street here. We're going to keep this ankle kind of relaxed, right? So now I can get under that Achilles tendon. And right here, we run into more problems. So what happens when this is restricted like this? One, he's missing out on 25% of the power he can generate in these tissues, which means he could be faster, he could jump higher. But he doesn't have it because as an athlete, his job requires him to use his muscles as much as possible. And if there's not proper maintenance, this happens. So if I'm in here, this is the muscle that goes to your little piggies here, right? So up here, unlike the other two muscles, not too bad. And then we go a little lower, not too good, right? Now, let's move on. So now, we're gonna look at that posterior, you got some serious socks here.
Yeah, I got two
Okay,
socks on.
so what I'm looking at now is these posterior ligaments of the ankle. If they allow the ankle to stretch out, he'll be able to move further. Right now, I'm not thinking, just due to my tension test, that these are going to be a big issue, but firm and tender, tension building as I do this, these are signs that he has a problem. So posterior talofibular ligament here lives right here. As I go in there, he's making a stank face, so I know there's a little something in here. So this is one element that's probably something more minor than the other ones, but it's also limiting his function. As I go in here, more stank face on JP's behalf and a little resistance on his behalf. So that's telling me both ligaments are affected. His big toe is probably the biggest problem, and then followed by the tibialis posterior muscle that actually plugs in right in here in the bottom of the foot. Now, one thing I don't have with me is my hand tool where I can look to the local tissue where he had the stress fracture. And when there's an excess amount of inflammation, there's often going to be local adhesion as well. So we can't do that here, but we already know that he has things that are very fixable there. So if you want that 6 to 10 tension to go away, we need to get that sorted out. Any questions? There we go.